I'm going to turn it over to Zoe Levitt, who has really been our lead on this project and this partnership with Causa Justa Just Cause. And so here's Zoe.
All right, thank you. So good morning or afternoon, everyone, depending on what time zone you're in. So I just want to start out with why we worked on this report. I think, as we know, gentrification and displacement, they're not traditionally understood to be public health issues, but we actually know through research and data analysis and the community stories that were collected as part of this report that these are actually some of the most important public health issues facing our communities today. And they really, not only because they have public health consequences, both for residents in gentrifying neighborhoods as well as those who are displaced and our broader society, but they actually really affect and undermine our broader efforts to build healthy communities. So as Anna just went over, our Place Matters initiative here at Alameda County is really focused on local policy change. And all of that work focuses on trying to make sure that residents and communities have the basic resources and opportunities they need to live a healthy life. I'm sure that's something that all of us on this call really have as a motivating force in our work, is really building the resources and opportunities, making sure everyone has the chance to live a healthy life in a healthy community. We also recognize that in Alameda County, and I'm sure across the nation as well, in many cities, many communities, particularly low-income communities and communities of color, have actually been excluded from the kinds of investment that was needed to make their neighborhoods healthy. So including financial resources, investment in housing and basic infrastructure, as well as critical resources like grocery stores, parks, and banks. Many communities here in Oakland still lack the basic investment that is needed to make their neighborhood or community healthy. Unfortunately, what we were hearing through our local policy work and what we're hearing from many of our community partners and seeing as well is that when development does happen in historically disinvested neighborhoods, too often it leads to displacement of existing residents. And so what this means is that those who have worked and contributed and lived in their neighborhoods for years and often need the investment the most are not able to stay and benefit from those changes. So this was really an important opportunity. When Causa Justa approached us to work on this report, it was an opportunity for us to better understand what the public health consequences are, as well as what our role is in advancing solutions. So another aspect of this is we know there are public policy solutions. This was a chance for us to explore what those solutions are. And historically, public agencies have a very critical role to play, including public health departments. This is a photo from the Fillmore Western Addition neighborhood of San Francisco, which was actually one of the largest urban renewal projects across the country in the middle of the 20th century. And this was a public policy that I'm sure many of us are familiar with that was very devastating for many of our cities and actually was one of the strongest factors contributing to the displacement of Black communities from our cities, and was definitely important in the Bay Area's transformation and continues to affect the legacy of development today. So we know that public health departments played a role in this era of public policy, and therefore we have a role to play in advancing solutions and really preventing displacement from future development so that all communities can benefit from the changes that they need. So who is Causa Justa Just Cause, also known as CJJC? So this is the grassroots organization that really led this report. And they were born from a visionary merger between a Black organization and a Latino organization here in the Bay Area with roots in East Oakland, West Oakland, and San Francisco's Mission and Excelsior districts. A lot of their work focuses on bridging and creating solidarity between communities of color, including Black and Latino communities. And they provide a range of rights-based housing, legal and advocacy services, as well as direct action policy campaigns and organizing. They've provided a lot of the vision for this report, and actually were one of our earliest partners in the Place Matters initiative. And so we've had a history of partnership with them that began with an effort to prevent water shutoffs in foreclosed homes in West Oakland, which was one of the first community partnerships that we worked on to really address the root causes of health inequity. So what is gentrification? So one of Causa Justa's goals for this report was really to put forward a very specific definition of gentrification. I'm sure as many of us are familiar, this term can be very polarizing, and a lot of times what we'll hear in public meetings from city officials as well as from the media and from developers and community members as well, is that, you know, gentrification is the same thing as development, or gentrification is good for communities, or, you know, maybe that it's something that's inevitable. And we actually, this was an opportunity for us collectively to really challenge those understandings. So this definition that Causa Justa put forward was very much based in their analysis of the neoliberal development of cities. And one of the core parts of this is really pointing out that it's a profit-driven process. It's not the same as development, and it's a form of development that's very much focused on generating profit and actually happens very specifically in historically disinvested areas. Another point I want to point out here is that often gentrification is understood as being driven solely by the private sector or by individual residents, and actually what we know is that public policy plays a very critical role in facilitating gentrification. So that's something that we wanted to really centralize in this report and explore more so we can understand what the solutions are. So reframing gentrification, as I mentioned, gentrification is not the same thing as development, and I think that this is often used to dismiss concerns raised by communities around gentrification and displacement. What we hear often is, you know, well, does this mean that you're against development, or does it mean that you're against any progress or any change? And that is absolutely not true. As one of our partners at Causa Justa often says, you know, we absolutely, communities know that things need to change. They know everything that needs to be addressed in their neighborhoods, and there's a lot that's still, a lot of investment that's very important that still needs to happen. However, gentrification is a form of development that does not actually benefit existing residents and instead leads to their displacement. And so we also, one of the other core parts of this report was really understanding what those health impacts are, because we found that it harms the health of individuals, communities, and our broader society. So this map is actually the result of one of the analyses we contributed to this report. So we actually used a data-driven method of measuring gentrification that looks at the extent and the progression of gentrification based on census data between 1990 and 2011. And this was adapted from methods used in a report in the city of Portland to really look at changes in property values, demographic shifts, and the loss of renters, low-income people, and people of color from neighborhoods throughout San Francisco and Oakland. And what it allowed us to do was to categorize neighborhoods into different stages of change. So what we see here is that neighborhoods like the Mission in San Francisco are already in late stages of gentrification. This is at the census tract level, but it gives you a sense of where different parts of the city are in the process. One of the other important aspects of this analysis was not only did it give us data to actually measure and validate the reality of this process and, you know, show that it is happening, but it also gives us a way to target policy solutions. Depending on where a neighborhood is in the process, different kinds of policy interventions are most effective. So what we learned is that gentrification is dramatically reshaping our cities. There were a number of very powerful statistics that we learned through this process, and actually were able to create some numbers to give a sense of the change. So, for example, in Oakland, we've seen substantial displacement from both gentrifying neighborhoods and our cities as a whole, and the number of Black households in North Oakland decreased by 2,000 between 1990 and 2011. So this is quite substantial. At the same time, Black homeownership dropped from 50% to 25% of all homeowners in the neighborhood. And the Black population in Oakland overall decreased as a share of the total population from 43 to 26%. So we were really able to kind of give weight and validation to this sense of displacement and this concern that communities have by being able to measure it. We also, in terms of the health impacts, we really were able to, through a process of collecting community stories and through interviews, data analysis, and an extensive literature review, we were able to understand what those impacts are on not only those who are displaced, but those who are left behind in the neighborhoods where their neighbors have been displaced, as well as our broader society, and to understand what some of the ways that public health can support this and prevent displacement. So I'm not going to read through all of these, but to get a sense of what some of the impacts are, one of the things we learned was it's not just those who are displaced, but actually for long time and existing residents in gentrifying neighborhoods, particularly those who are low income or fixed income, gentrification can introduce a number of strains and stressors that are harmful for health. For example, it can increase the likelihood of residents being forced into overcrowded or substandard housing conditions in order to cope with the rising cost of rent. What it can also do is actually, we have an example through a data analysis we did looking at San Francisco neighborhoods that gentrification actually directly leads to an increase in evictions and eviction notices. And we saw that during the dot-com boom in San Francisco, the number of eviction notices spiked during that period. And so we know that the potential for landlords to return higher rents is very real, and they know that is possible, and there are greater instances of landlord harassment and eviction as a result of gentrification. We also saw widening health inequities. We looked at comparing neighborhoods in early to late stages of gentrification in San Francisco. We saw that actually the racial disparities in mortality rates were highest in those late-stage gentrifying neighborhoods. One example I'll share also from the report, which was generated by an interview with a community organizer there, is that the social networks in a community are really some of the most health protective assets that communities have. And those are things that are very much disrupted by gentrification and by displacement. There was a story of an elderly resident who lived in a neighborhood in LA and had coffee with her neighbor every single day. And one day her neighbor noticed that she hadn't come over for coffee, and she got very concerned. And she actually went over and found that this woman had fallen into a diabetic coma. And so those kinds of neighborly relationships can literally save lives. And so this is something we really wanted to highlight and lift up in this report. And the stories that were shared were very real about what those the importance of those social networks are. For residents displaced, we found some interesting findings around what happens when residents are actually forced out of their neighborhoods. In addition to the financial strain and disruption to work, school, and healthcare access, oftentimes when residents are low income and they are displaced because of unaffordable housing conditions, they're very likely to be displaced to outlying areas of the region that are farther from urban centers and which actually have lower levels of public transit access and other amenities. And so this is actually something that we should be concerned about as public health practitioners who are really striving to make sure that residents have access to the kinds of healthy amenities that they need. And this might even lead to increased driving and greenhouse gas emissions as displaced residents are forced to drive further to reach old places of work and school. One other point I'll note is that we found through a migration analysis of where different communities move that across the income spectrum, African American households are more likely than other groups to move to a neighborhood with lower income residents than their previous neighborhood. And we also know through our ongoing data analysis, through the work of our epidemiologists, that neighborhood income is strongly correlated with the quality of neighborhood resources and amenities. And so this is very concerning for the racialized impacts of displacement in terms of where people are forced to move and the kinds of resources that they'll have access to. As I mentioned earlier, this is something that we should be concerned about for our broader society, as it can increase segregation, and as residents are displaced further and further from their center city areas, there are concerns around driving, greenhouse gas emissions, and just overall sustainability for our cities and regions. So what are the solutions? Well, there's actually a lot of solutions. So if anyone has taken a look at the report, I encourage you to check out page 55, which is the beginning of the policy recommendations section. And so what you'll see here on the slide is actually kind of our framework of principles that we came up with collectively with CJJC that outlines the overarching principles we think are necessary to really prevent displacement. because gentrification is a complex problem, and therefore it doesn't have a simple silver bullet solution, but really requires action on multiple fronts and at various levels of decision making. So the very first one is focused on baseline protections. This is what we call, or what CJJC calls the frontline defense against displacement. And pretty much what this means are tenant protections. So in the Bay Area, we are lucky to have a lot of strong tenant protections, although they could still be very much strengthened. But this is things like, this means just cause eviction protection, as well as protections against harassment. And I'll go into an example of one of the policy victories we've had here locally in Oakland. Eviction really is the first place where residents are displaced. If you're displaced from your home and it's already a tight housing market, that can likely mean displacement from your neighborhood and potentially even your city. The second principle focuses on affordable housing. So one of the common solutions that's put forward for displacement is often the production of affordable housing. And while we know this is very important, we actually believe preservation is equally important, because our existing housing stock, particularly in older cities and cities that have a lot of affordable housing already, that existing housing stock is very valuable and something that needs to be preserved. And so this includes both the quality of the housing as well as the affordability. So some of the efforts that we've highlighted to preserve affordable housing include proactive efforts around code enforcement to ensure that landlords are actually maintaining their housing in healthy conditions, as well as working to implement and strengthen rent regulations so that landlords cannot unfairly raise rents on their existing tenants. I won't go through all the other examples, but I think that we wanted to think about displacement as being something beyond just the local level, and so we did include a principle around displacement as a regional priority, because it's something that really affects the whole region, and therefore we think that regional and metropolitan planning organizations do have a role to play in terms of incentivizing local jurisdictions to take action against displacement as part of their regional planning processes, as well as through funding streams that might be available for cities. The last principle is something Anna will speak to a bit more, but the actual decision-making process around land use planning and development is very important, and we think that, and we know through experience that when communities are directly involved in the decision-making process around development and land use planning, it's less likely to result in displacement because it will be directly responding to their needs. So some of the outcomes from the report, we were actually, we weren't surprised, but we were impressed by the amount of media coverage from this report. I think it really came at a time that was, it was very timely in terms of the reality of gentrification and the housing market pressures affecting the Bay Area. And so I think we've had over 25 separate stories in print media and TV about the report itself. And a lot of this actually did highlight the public health frame. So that was a very valuable outcome from this collaboration. We've seen greater dialogue. We've seen more actual elected officials talking about and using the term gentrification and their concerns about it in a lot of our local policy decision-making spaces. So that's been a huge victory, we think, as well. There have been some very specific policy victories, including something called the Tenant Protection Ordinance that was passed recently here in Oakland. And we continue to receive requests for ongoing, not just for presentations, but for actual follow-up analysis and research related to this issue, as a lot of other health departments and organizations are interested in doing similar analyses in their communities as well. So these are some of the examples of the tenant rights victories that were either happened already or ongoing efforts here in Oakland that Casa Justa is leading the way, and they're part of a broader coalition called the Tenant Justice Campaign that Place Matters has been working with very closely as part of our housing work group. So just in the last year, this coalition won stronger rent regulations in Oakland that actually capped the rent increases at a lower level than what was there before, and also actually prevented the ability of landlords to pass off the costs of capital improvement projects onto their tenants. As I mentioned, the Tenant Protection Ordinance was a great win, because this actually defines several types of harassment and prevents landlords from doing things like neglecting to provide basic repairs. It actually defines that as a form of harassment, and also provides additional protection for undocumented immigrants, as well as for other forms of landlord harassment that can often be used to drive tenants out. So I'm going to actually pass it over to Anna to talk a bit about the value of the public health frame and an example of a project we've been involved with here.
Zoe? Yeah, I think what this report and the outcomes of the report as well have really shown is that there is really strong value in having a public health frame when talking about gentrification and displacement. You know, often, like Zoe said, there's a lot of talk about housing, and actually, you know, gentrification and displacement, as the analysis showed, is actually interrelated with many different issues. And so when solutions are framed, they focus on housing, specifically on building affordable housing, but I think what the analysis shows that Zoe did is that there's actually many intersections with other areas such as education, health access, jobs, access, healthy food access, the environment, social networks. She had a really good example about that. So this was really important because, one, we point to the fact that the public sector really has an important role to play in solutions in preventing gentrification and displacement and protecting existing residents, and that we also, this frame around public health actually allows us to reach a broader audience. And so that is actually really helpful in making the case and supporting the claims of existing residents that it really is having an impact on people, on our residents' health. And it also has an impact on where we target our services for our residents. If, you know, the residents that we're doing place-based targeting of our services, if, you know, the communities are being pushed out of those neighborhoods, then, you know, they don't necessarily take the services with them. And so that really has implications for public health and how we do our work. And so another opportunity that this report really gave us is to really try to reframe development around healthy development, that we're really focusing on the needs of existing residents. That this is a framework that was developed as a result of the report that you know, there should be protections for existing residents in development, that they should have the right to stay and benefit from the neighborhood change, that they should be included in decision-making processes around land use and development, and so that their visions are realized for the transformation in their communities. And so it's about equity, right? So ensuring that these communities, particularly the ones that have been disinvested, are really being able to capture the investment for their neighborhoods. And really it's about improving the living conditions for these folks and improving the health outcomes for all our communities. And so I wanted to show you another way we're using some of the finding is in the project we're working on. It's called Healthy Development Guidelines. And this is a partnership we have with East Oakland Building Healthy Communities, which is an initiative through the California Endowment, Place Matters, and also the City of Oakland Planning Department. So this project really has a few goals. Really it's about applying a health equity lens early on in the development review process. So getting a tool that the Oakland City Planning Department will actually institutionalize and use as they review projects, The other goal is really to make planning a more participatory process, and really getting planning to be aware of and address and create goals around meeting the needs of existing residents. And so, the tool includes the process has included a resident advisory process, and so they've been engaged in creating this tool, but they've also been the ones helped to make decisions about this tool. And the tool has a set of development standards for new development, and then a set of recommendations where if there are like policy solutions that need to be made before institutionalizing the development standards or goes beyond the development scale, we've created a recommendations list, and this is really turning into a policy agenda for building healthy communities in place matters. So we're assuming that a lot of the folks on the call are already or looking to do more of these partnerships with community-based organizations. And so we thought it'd be really helpful to share our lessons learned from the partnership. So we, as Zoe mentioned earlier on, we really had an existing relationship with Casa Justa Just Cause, where we worked on a previous report on foreclosure and had been working together for some time. And so we were really building on that when we did this report. So just want to note that. But we really found that this was, while we had different roles and power, it was really actually complementary and really worked well in a lot of ways. We found that we were able to bring stronger and richer evidence as they brought like community-based community stories. We were able to bring the literature and the analysis, and pairing that together really created a really stronger case and a stronger report than if we had done something separately. It also allowed us to understand this issue in a deeper way, and then come up with solutions that were a lot deeper in breadth, I think. And then it really helped us to take this research and put it into action. And so that has been really key, is like using the data and the analysis and the things we've captured to really impact policy change. So as we mentioned, Casa Justa really brought this data and the stories from their on-the-ground experience, bringing their community leaders to share their stories and share their experiences, and also be ready and be bought into this process around the report to really, when it came time, to really bring people power and bring the residents most affected to city council meetings. And they also brought like a really strong analysis around the policies and campaign strategy development. So they really had that outside strategy, whereas what we brought was some of that inside influence, right, that we could have on other public agencies and decision makers. The Public Health Department brings some credibility and resources as a public agency. We have the health officer is also our director, and so that brings an extra sense of urgency, credibility to different audiences. And also we have a CAPE unit, a data unit that really brought strong analytical capacity. So now I'm going to turn it over to Zoe.
Okay. So just a couple examples of what we learned, because this kind of partnership is very fruitful and is also challenging, and each organization has different ways of working and different cultures. And even, you know, I think as each project that we've worked on together with Causa Justa has deepened our understanding of each other and also how well to work together. So I think a big part of this is just really understanding the different ways that we work and what our roles are, and as Anna discussed, the inside-outside strategy. For example, you know, as the Public Health Department, our tone and messaging I think will and needs to be different than Causa Justa's in terms of what we bring and what we present at testimony, and as well as the kind of information and data that we can provide in public forums and policy debates. And really what anchors us and gives us our credibility and helps us be a strong partner is the data and the research. And so understanding ourselves and also helping our partners to understand that is what makes us a strong partner, as well as, you know, our commitment to really working very closely and really understanding the needs and the priorities of our community partners. One thing that we did with this report, which Causa Justa really prioritized and led at the beginning, was we spent a fair amount of time together. The core team members, there are about 3 of us on the Public Health Department side and about 4 people on Causa Justa's side. We spent a lot of time coming to shared goals and understanding of the definitions and terms to really both to learn about each other, but to get some common ground that I think continue to be very important for our ongoing work together, particularly through, you know, more challenging or stressful moments in the report process. And I think that time, while it seems, you know, like you might want to just get into the research, I actually think that relationship building time is very important, and it's important for trust building as well. In terms of anchoring, we always try to anchor our analysis in community experience, and so to give an example of what that means, as part of this early process of developing shared goals and definitions, Causa Justa organized a community feedback session to introduce the project, to introduce the definitions that the core project team had come up with, and to get feedback from their members, who are really the residents most affected by gentrification and displacement, and to get feedback, to strengthen the definitions, to actually collect stories about how people's health and well-being were being affected by this process. And those stories actually were really were the framework for the research that we conducted. We started with the community stories, and then from that process generated a lot more questions, and also now had this additional evidence that we could use to craft our narrative. So some of the stories that were shared actually helped us in our process of looking for additional data and research to better understand some of the impacts people were experiencing. So that's really how we started the whole research process. And I think that that's something that is very different than traditional approaches to research, and might seem foreign to public agencies and public officials, but was actually very important for our process of working together. I think other things that we've learned are just, it's an ongoing process to make data jargon accessible and plain in terms of language. And I often felt like I was playing the role of translator between our epidemiologists and our community partners, but it's actually a really good it's really good to have someone in that role, or to have, even if you are a data person yourself, to really understand how to break it down into accessible language, and what are you really saying with this analysis. And also, I think we've both learned from each other. So I think that our community partners at Causa Justa have gotten very savvy about the public health language, the frameworks, the data. And on our side, I think our staff, and myself included, have gotten better at, understanding sort of the questions and the priorities of our partners, so we can better support them and better respond to their requests around the data. So what can public health do? This is obviously not an exhaustive list, but these are things that we're trying to continue to do, and I think that other public health departments and organizations can do as well, and really starting with the collaboration. I think that we know gentrification is happening across the country. It's happening, I'm sure, in many of your communities. It looks different in each place, and the needs of communities are different, so we think it's very important to collaborate with CBOs to understand what's happening on the ground and what the development issues are in your community. I think, as we've discussed, providing public health data and analysis in those public decision-making spaces can be very valuable and can help actually change the debate into a, pro-con development polarizing thing to actually having meaningful substantive discussion about what should neighborhood change look like and how can it happen in a way that's healthy for those who've lived in their neighborhoods and cities for a long time. Public health can support the adoption of anti-displacement policies through giving testimony at public meetings, providing research and data that can help community residents better illustrate the importance of their stories. And that's something that we continue to do. We've gotten many requests for providing data and testimony at development project decisions. Last night I was at a planning commission meeting until very late to provide testimony about a project that's being proposed in Oakland. So it's something that's ongoing, and public health can play a role in that process. So we do have the report. We have a link to the report that we will share at the end, but we think it's, we want a lot more analysis to be built off this. It's definitely not the end of the story. We know it's just the beginning, and we'd love it if you all can share it and send your thoughts and feedback to us and build on it and expand it in your area as well. So I think I'm going to end there and make sure we have time for questions. I guess we'll pass it back to Maurice for Q&A.
Okay. Yep. We will open the session to the questions that we received. Okay, so question number 1. Zoe and Anna, what approaches can communities take to make sure that people are able to stay in place before it reaches that threshold where property values are so high that people who've been living there for decades are priced out?
So what approaches to reaching that threshold, is that what you said, like that perfect balance?
Yeah. Like what approach, basically, what approaches and avenues?
Yeah, I mean, I think that's a really good question. I don't think there's a simple answer to that. I think at this point, we haven't identified here's the exact place that communities or neighborhoods should be at in order to, allow investment but not displace communities. I think for us, we're really focused on the process of development and making sure, I think, fundamentally that the process is fair and equitable and inclusive for communities and residents who currently live in their neighborhoods. And so I think like we spoke about some of the tenant protection policies, we think those are very essential as a baseline because as, development and investment is important and it's something that all neighborhoods and communities deserve, but it should include community benefits, it should be based on the needs of existing residents, and we also think that when tenant protections are in place, existing residents are less likely to get displaced when new development does come into their neighborhood. And so I think those are some of the most important policies as well as the inclusive planning process itself. There's also examples like community land trusts and some of what CJJC calls non-market-based approaches to housing and development, which can be challenging to implement, but can actually have a very long-term effect in terms of securing land for affordable housing. And so that's an approach that more and more communities are taking to ensure long-term affordability.
Okay. And we have a second question that came up. It was, what health equity lens tool would you recommend health departments use and incorporate internally?
So when the healthy development guidelines are finalized, I hope that could be a good tool that other health departments and cities could look at to see what they can incorporate in their own cities. Just want to note on our process was really informed through a resident engagement process where and a technical advisory process, so that folks were really saying these are our priorities for our communities. So it's not meant to be an exhaustive list of development standards or recommendations, but really to fit within the context of Oakland. But I do think that when it is finalized, we'd be more than happy to share with the national collaborative so that that could be shared with the broader networks. And I'll just note that when we were looking at drafting our standards, there are some other tools out there that exist, and just the two off the top of my head. One is the San Francisco, it used to be called the Healthy Development Measurement Tool. I don't know what it's called now, but I'm sure if you do a search, you can find it. The thing with that tool is it's a planning department, or a health department tool. It's not institutionalized in the planning process, but it's a very, very comprehensive tool that has all the health data backing all the indicators that they've developed. Another tool that I've seen and talked to folks about is the Twin Cities has a equitable development tool, and this is a really community-friendly tool that they've used to inform the regional, I think, transportation process, I think it was. But, that's another tool that could be looked at right now. So we looked at both tools to try to inform our tool. And so, again, when it's finalized in the near future, we hope to share that with you all.
Okay, for our next question, how can we make cities more equitable and ensure that all people benefit?
Yeah, I think similarly to the earlier question, I think there's a lot of policy and practice shifts that can be made in how development happens. And so I will, again, refer folks to look at the list of policy recommendations. I think, as Anna mentioned, there's a lot of toolkits out there about equitable development, and I think, again, a lot of it comes back to the decision-making process, and I think that as more and more of these policies are implemented, and I think also part of it is just how we understand development as being, who are cities really, how are they facilitating development decisions, and actually who has the agency in those decisions. I think as that shifts more towards community residents and not focused primarily on developers, that the process will be more equitable and people will be benefiting more.
Yeah, I will share that while we're talking about how to do the work, we're also doing the work and trying to figure it out. And what's happening in Oakland right now is a lot of specific planning processes. So it's the general plan level changes the city is making to facilitate development in Oakland as the tech boom kind of trickles over into the East Bay. And so what we are working on is actually a set of recommendations that we share with planning commissioners, city council, and the broader public around policies that could be put in place on the general plan level to support equitable development and protect and preserve community existing residents and ensure that some of the benefits from development go to existing residents. And actually Zoe is working on a I'll call it like maybe an executive summary or a policy framework kind of summarized that we hope to post on our website soon that maybe could be used as a tool to insert into the policy conversations that you all are having in your cities and counties and regions. And so, because the report is pretty lengthy, but we wanted to put something really usable and concrete out there for folks to use in their own sites.
Mm-hmm. And part of that would be actually tailoring the recommendations to different levels. So, for example, what we're hoping this can show is here are the policies that should be incorporated into specific plans, as well as for specific development projects at the project level. Here's what we would recommend for different types of projects, and also depending on where they're located in the city and sort of the existing conditions. So so that is something we hope to share within the next several months.
Maybe you can share about the regional one. No.
Yeah.
Okay. I'm sorry. Go ahead.
Oh, I was going to share another example, but I can wait to see if there's other questions first.
No, that was the last of our questions. So I was just going to ask if you guys have any closing remarks that you want to give to everyone.
Yeah, well, I think this is obviously an issue we're all still grappling with and still learning about. And I would just say we'd love to hear from other Place Matters teams, other health departments, and community organizations who are really working to find the solutions, because we know some of the solutions, we don't know all of them, and I think it'd be great to just have an ongoing dialogue about this. So we'd love to hear from you, and please feel free to send us any questions. We look forward to being in communication with all of you.
Yeah, and I would just say thanks again for this opportunity. That we found that this is a really important issue right now for our region, and I'm sure your region, and so yeah, we'd be happy to it'd be great to kind of continue this conversation as part of the national collaborative somehow, and just figuring out how we share our solutions and lessons learned continuously moving forward. And so thank you again. Thank you, Maurice and Muriel, and look forward to working with you all soon.
Okay, well, we have one final question. We do have 8 minutes before the hour mark, so if you guys want to take one more question.
Asthma, okay. Sure, we can take the final question.
Okay, so we have one final question, and then we're going to go ahead and close it. The question is, do you track any measures around health conditions such as, I think it's asthma, COPD, STIs, or violence after gentrification occurs?
Yeah, this is a great question. So in the report, we weren't able to track very many specific health outcomes as a result of gentrification. I mean, I think it's a challenge, but it would be very important to do that. And we were able to show, as I mentioned, some of these high-level disparities in mortality rates. For example, we saw an increase in overcrowding, overcrowded housing conditions in gentrifying neighborhoods. That was more of a social determinant of health. But I think around these health outcomes, what we're actually exploring with Causa Justa right now is they just submitted a collaborative grant proposal with our department as well as other health clinics within our health system to kind of build on exactly this type of analysis and understand at a more concrete level and kind of drill down how the experience of gentrification and displacement can actually directly lead to these health outcomes, and actually tracking data through health clinics as well as through CJJC's housing clinic, tracking data, sharing resources so that we have not only a better understanding of those concrete connections between what they're calling the trauma of displacement and conditions, mental health conditions, violence, asthma, things like that, but also helping to refer patients at clinics to housing resources and vice versa. So I think that's actually a connection that we're just starting to explore, and we'd love to hear if folks are doing this elsewhere, and it's something we'd love to have more to share in the near future, hopefully.
Awesome. That sounds great. At this point, I hope you all have found this webinar this week to be informative and helpful. At this point, I'm going to close the webinar out, and I would like to thank you all for attending, and I hope that you all have a great day.
Thank you.
Thanks.
And the final information is the recordings of the slides. If you would like to view them later, will be uploaded to the National Collaborative website, and that website address is www.nationalcollaborative.org. Thank you.